Welcome to the Environmental Health Profession Series, where we highlight professionals working every day behind the scenes to protect public health and our communities. I'm Jeff Moody, the Bachelor of Science in Environmental Health program at Old Dominion University, Virginia's only EHAC-accredited undergraduate environmental health program. Today, I'm excited to welcome Tiffany Johnson-Wiggins, Environmental Health Manager with the Alexandria Health District of the Virginia Department of Health. With over 15 years' experience in public health, Tiffany has served in multiple environmental health and leadership roles since joining Virginia Department of Health in 2011, including Environmental Health Specialist, District Standardization Officer, Environmental Health Technical Specialist, Environmental Health Supervisor, and now Environmental Health Manager. Tiffany is also an alumna of Old Dominion University, where she earned her degree in biological science with a minor in environmental health, and she has completed graduate level coursework in public administration. Throughout her career, she has demonstrated leadership not only in day-to-day environmental health operations, but also during major public health and emergency response efforts. In 2018, she was selected as part of the 13-person environmental health strike team deployed to U.S. Virgin Islands following Hurricane Maria, supporting environmental health assessments related to food safety, drinking water, post-storm environmental health hazards. During COVID-19 response, Tiffany also led critical logistics and operational support efforts in Alexandria, helping coordinate supplies, transportation, inventory management, and point of dispensing site operations during one of the most significant public health emergencies in recent history. Her career reflects the important role environmental health professionals play in leadership, emergency response, preparedness, and community protection. Tiffany, thank you for joining us today, and welcome to the Environmental Health Profession Series. Before we begin today's episode, we want to share a brief disclaimer. Our guest, Tiffany Johnson-Wiggins, is participating in this interview voluntarily. The views and opinions she expresses during this conversation are her own and do not necessarily reflect those of Virginia Department of Health, the Commonwealth of Virginia, Old Dominion University, or any affiliated entities. Her comments are intended for general educational and informational purposes and are consistent with the Virginia Department of Health guidelines. This episode should not be considered formal regulatory guidance or legal advice. Hey, Tiffany, thanks for joining us. I appreciate you spending your time with us discussing about environmental health. I appreciate any of the wisdom you had to share. You had a long, extensive history and some actions in environmental health that you talked about. I talked about in your bio. So we're looking forward to learning more about those types of issues and then sharing it with the rest of the population. So tell us a little about yourself, your current role with Alexandria Health Department.
Yeah, no, thanks for having me, Jeff. I appreciate you. If anything, I'm hoping that you can impart some extra wisdom upon me in the field of environmental health. We're always looking forward to receiving
Absolutely.
just as much knowledge as we give. So right now, I'm an environmental health manager at the Alexandria Health Department. Love what I do. Basically, on a day to day, we just oversee the system. I just oversee the systems that keep our communities healthy. It's a little bit of everything: strategy, strategic planning, operations, assisting with the supervisory team to ensure that all the different programs that fall up under that environmental health umbrella run pretty smoothly. It's fast paced. I love what I do. Every day is a different day. Um, I feel like no 2 days are the same. So, yeah, that's pretty much an overview or a quick summary of what an environmental health manager
Yeah,
does.
thank you for that. That's you're always busy, and I appreciate you just even today taking your time out. So this is and all things that happen in environmental health, that whether it's your some of the significant events you had to deal with in the past couple months there in the DC capital region, and as we are dealing with all the other things that's on the news, the Ebola, hantavirus, it's nonstop, right? So I appreciate all these things that you're going to be able to share with us. So, what originally drew you to the environmental health profession?
Um, science is Science is my first passion. As a kid, I've always loved it, and then just going through school ages and into college, I loved it. But I also love working with people. I'm a pretty much an open book. I like
Yeah,
to meet new people. I like to network. So I feel like environmental health bridges those two things and allows you to give that to the community. So it
oh
allows
yeah,
you to deal with people
absolutely.
and still have some of that science skill to put out into the world too.
Yeah, 50% or if not more, is of our job as people. I would say that the P in public health stands for, people will say politics, but that's part of people. So that's what we have to deal with, and then being able to interact and convince people how to do better in their environment is one of our number one priorities and challenges we deal with.
Yeah.
Yeah,
I mean, you're absolutely right, Jeff. Dealing with people is the majority of the job, right? But you get to do it simultaneously. You get to deal
yeah,
with people, but you also get to work through that science mind, put it in layman
yeah,
terms, and make sure you get that out to the community.
yeah. So in your growth in your profession as a daily practitioner, what were the specific experiences, mentors, or the moments that made you realize this field was for you?
I'd say Old Dominion played a part in it. I always tell
I
people
like the
I
plug.
kind of fell
Appreciate
into
that.
oh yeah, for sure,
Yeah,
for sure. I kind of fell into environmental health. But once I got into the field, I realized that I truly enjoyed what it had to offer me. I did a personality assessment, to be honest, Jeff.
yeah,
And I said, what would make me happy? What is the mixture of me being in an office, conducting administrative duties, which is involved in most jobs, right?
yeah.
And then what would allow me to have some freedom out in the field where I can go and meet people and be in the community, because I always wanted to be a part of public health. To what capacity, I didn't know, but environmental health gave me that happy medium to be able to be out physically in the community and still be at the health department and available and accessible to our residents as well.
Yeah, I think we had a conversation where we're both like we're both pre-med, right? Our sciences,
Yeah,
our background, our physical science backgrounds. So we're all going into that pre-med, going to medical school thoughts. And I mean, just like you said, kind of fell into it and then found the love of like, this is, we're serving not necessarily one patient, like you're putting your hands on a patient, we're putting hands on populations. So that's a very
yeah.
big key.
And to directly answer your question a little bit more, when it comes to mentors, I've had so many, Jeff, and that's the joy of environmental health too.
Yeah.
When you it's such it it's such a broad scope of expertise. We put our hands in a lot of little different things.
Yeah.
So the people you meet are extremely interesting. They are more than willing to share information with you that they've learned. And quite frankly, I brag and say that environmental health is the fun division. We are the division that you would think we would be a little grumpy because people don't always like to see the health inspector come through the door.
Yeah. Of
We
course.
are truly the most fun. I mean, you have to be lighthearted to
Yeah.
be in this role, and if you have to love people truly through everything, through their good, through their bad, and see the common goal and know that that's what you're all working towards. So
Yeah.
mentors come from beginning to end. I mean, from people that I now manage, believe it or not, anybody can be your mentor.
That's right.
We'll talk a little bit about that later, but I feel like everybody has given their pieces of the puzzles to make sure that I become a better me every day as it pertains to me being an environmental health professional.
Yeah, we weave this beautiful tapestry of multiple influences to create our superpowers to be able to be influential in that space, whether we're doing inspections or working with disasters in the public to create better solutions. So that empathy, that being creating relationships, those are
Yes.
all parts of the people challenges that we have to be able to grow through. So when I look at like as I wasn't a great public speaker or anything like that when I was younger. I would stumble and mumble and all those other things and having confidence. Uh, but I think in this profession it kind of it grows into you. So and having those mentors like you mentioned to be able to help develop those skills to be able to do that. So I think that's when we talk about some of the professional development later on. Those are the things I would like to touch upon because that for the audience that's maybe listening to this, they can see that yeah, it's scary at first, but it's once you get through it and learn it and you're a second hand to it, and it becomes more opportunities, more things out there. So
Yes.
so for people unfamiliar with environmental health, which is a lot of people besides us, right? So we're the ones that know everything about our job. So when you ask us that, what tell us what you do in 60 seconds, there's not enough time in that, right? So for people unfamiliar with environmental health, how do you explain environmental health professionals actually do?
I guess in layman's terms, if I had to describe EH as a whole, like what do we do in one sentence? Um, we we implement preventative measures to make sure that people don't get presented with certain risks. So I always say we're the preventative division as well. We don't necessarily, people think of health department, they think of treatment, treatment, treatment. The
Yeah,
reason why I think people are so confused about what we do is because we kind of get in there and solve the problems before they arise, right?
absolutely. Yeah.
Think about a restaurant inspection. We come in, we conduct these routine inspections so that you don't get sick. We don't necessarily get the camera, the 15 seconds of fame,
No.
um, for curing someone, but we definitely do a lot of the background work, that ensures that we don't have an influx of foodborne illnesses, waterborne diseases, uh, rabies, for example. People don't realize that one day I might inspect a restaurant, inspect a swimming pool, and then go try to find the raccoon that bit
Yeah.
somebody's child all in the
Oh
same
my
day.
goodness. Yeah.
So
Or the dog that's their pet that didn't have rabies shots to begin with, and it's a 6-month quarantine, and all the other things that go along with
correct.
that they don't realize, or they just think that we're just trying to take their animals, and that's not the case, right? So it's they always think that we're the police and we're coming in to take them to take them away for somewhere else.
And that's where, Jeff, like you spoke to previously, that's where you take the opportunity when you're in your role to make sure that you equip yourself to be able to communicate properly to the people that you serve. Make sure you educate them, make sure that we take the time to explain why we do what we do, because a lot of times, it's easy to go in and say this is a regulation or this is a
Right.
requirement. But when you're able to provide that public health rationale to someone and really tell them why the job is important, I think it turns on a light, and they're much more welcoming to accepting that information.
Absolutely. It's advocacy you're playing, not necessarily the enforcement. That's the regulations, that's part of it, but it's the advocacy to help them put them in a better situation to solve also their problems that they're going through. That's the
Yes.
that's what we ultimately are. We're solutionists in the out there in the environment, day to day. So that really leads me to another question: is that what skills do you think are most important for success in environmental health today?
I think you spoke to him like you said. I want to dial it back a little bit, like you said before. Like you have to be a great problem solver, right? Like the technical knowledge is important. We want to know that. Like we want to know our jobs. You want to know the regulations, but the some of the more important skills you can learn the regulation. You can read a book any day, right?
Absolutely. Yeah.
And but the people skills are going to be the highlight of anything you do.
Yeah.
um, Knowing how to reach people, with different backgrounds, different economic status,
Yeah.
um, you
Language
know,
barriers. Yeah.
yeah, language barriers, challenges with,
Yeah.
cultural differences.
Yeah.
As long as you learn how to speak with people and you develop your strategy for education, and when I say education, I mean actually providing education to the community.
Yeah.
I think that's one of the biggest skills that we can put out, um, or that we can develop as environmental health professionals. Uh, Communication skills, public speaking. If you're not strong in public speaking, I think it's a skill that you should develop. It's helped me tremendously
Yeah.
along the way.
Yeah.
The technical knowledge, like I said, it's there. It'll come. I think sometimes people get overwhelmed by what we have to learn. I
Yeah.
always tell staff we're many lawyers,
Yeah.
uh,
It's
but
interpretation, right? How can you interpret the information, the codes and regulations
yep,
and so forth to be able to provide it to the layman's speak to make a difference? It's not easy.
absolutely
And also to use codes to your advantage as well to be able to people try to run circles around you like, oh, that's well, let me cite this code that references this original code and this based on this science that was why it was developed. So
right.
yeah, but that takes
Yeah,
time. I could several. many eons ago for myself, and was that that part was not necessarily trial by fire, but it's part of the growth and being uncomfortable, getting comfortable with being uncomfortable. That's you probably heard that saying before. Uh,
Yes.
that way you can improve those, add more tools to your toolbox. So that's the elements that maybe some of the maybe it's your own experiences if you can share of like of your new hires that are struggling through those trying to interactions and being able to get out there, put themselves out there.
Yeah, and I think it's very scary for newer professionals entering the workforce, and rightfully so, or entering the profession in
Yep.
general, because I used to tell my family all the time. They're like, "Oh, well, how was your day at work?" Some days, you may feel like no one likes you, right?
Yeah.
Like, because you're the
Yeah.
health inspector, so to them,
Yeah.
it looks a certain way.
Mhm.
But as long as you keep your purpose in mind and you make sure that you separate what somebody may be going through
Yeah.
from what your intent and your purpose is for this work.
Yeah. Read the
Like,
room. Yeah.
read the room, know you're here to help, know when to step back, right?
Yeah.
And give folks time, um, and just kind of have the common goal in mind and work up the skills and the confidence.
Yeah.
And I think that comes with time, like you said, right? Learning the job. If I knew regulations front to back, if I could repeat the FDA food code to you,
Yeah.
I tell people all the time I would be a millionaire. Not here, right? Because that would
It should be
that
another
would
iPhone
require
app.
photographic memory. Yeah,
Yeah.
it's an ongoing study, right? And
Yeah.
things change.
Yeah. Yeah. And that's the piece to it
And
too, is like
yeah,
understanding the science behind it, why that regulation was created to begin with. Through SIFSAN and how they do that change. I mean, all those temperatures have changed over years, decades, and there's scientific rationale that's listed in the back of those FDA food model code that reference those rationale why it was there. And that goes back to your initial things that having that physical science background to be able to like, well, I'm supposed to do check the pools for the amount of free chlorine available and what the interaction with between. See, I mean, we don't need to understand the pKa values of chlorine and hypochlorous acid, right? But it's understanding how those interactions and the environment affects your day. So the science is very important. It's part of our curriculum. It's as a STEM H degree, but it does scare people. Oh, I got to take organic chemistry and all those other chemistries and physics and microbiology and toxicology. Yeah, those they're tough. But I could tell you that I didn't do that great in those times as well. But once you get into the real world, you have to know it to the point where you're now the expert, even though you might not feel that way.
indeed, indeed, and at the very least, know and understand the science and math associated concepts, right?
Yeah,
Like, that's what school preps us for. For all the folks, if anyone ends up listening to this podcast and they're actually going through the courses, I'm gonna give mom advice, even though
yeah,
I probably shouldn't, but
absolutely,
I'll give mom advice, right?
absolutely. Yeah,
Everything is temporary. You will get through it. You'll get through the organic chemistry. You'll get through the physics and the statistics, or whatever courses you're taking to get to the end goal, so you can obtain the educational degree that you're working towards. Um, Once you get done with that, you'll be able to see real world examples if you come into the environmental health field of how and why, how to apply those, right? How to apply that knowledge, and then why you were learning it. Because when you're in it, especially when we were younger, Jeff, when
yeah.
you're in it, you're like, how many times have you heard people say, "I'm never going to use this"? I'm
Hmm.
here to tell you that you
Yeah,
will.
every
You
day.
will,
Yeah,
to some capacity.
like carbon bonding and benzene rings. So so yeah, absolutely. Yeah, so that's it brings up what you're just saying about having that foundational background, the sciences. So tell me about what were your professional development career path. No one understands what we do. So as an environmental health professional that work behind the scenes, what are some responsibilities that the public may not realize that EH professionals handle every day?
I spoke to it before briefly, but I'll give some more. I mean, that's easy for program examples. In different health districts, different localities based upon the landscape, whether you're in a rural area or an urban area, you'd have different programs. You have the food safety program, which a lot of people already know about. You have on-site sewage and wastewater and drinking water. Uh, what else? Rabies prevention.
Yeah,
A lot of people don't know that we actually have that as a program.
yeah,
We inspect geothermal wells. That's a big thing that people are installing right now
yeah,
to try to be great energy savers. And then some of the day to day stuff, like you said, conducting plan reviews. Like people don't know that aside from they just look at us like health inspectors, like, oh, they inspect
yeah,
restaurants. So we inspect hotels, we inspect marinas. Um,
yeah.
we're responsible for looking at blueprints to make sure that if a restaurant opens or a pool opens,
How many
it's
hand washings do you
within
have in there? It's supposed to be where it's located. Yeah,
right,
yeah.
right.
What's the code requirements for
Um,
that? Yeah. And
yeah, I'm
before you can even open up a restaurant, you have to go through those clearances through the health department, fire marshal, city codes, you name it. And we're probably
yes,
the big, as a health department, you're probably the major hurdle that a lot of businesses have to go through, because that is a very defined process to be able to identify your construction of a kitchen, and your how
right,
many the people you're serving. So people don't
yeah.
really realize that probably that's a big piece to it. So that's a good thing.
Yeah, or assessing, you're looking at a restaurant, you're thinking, "Oh, this restaurant can just open," but how far is that hand sink
Yeah.
from that make table where they're making sandwiches and salads, and
Right.
how likely is it that they're gonna wash their hands if it's not there?
Right.
Or if they have to walk a certain amount of
That's
feet
where
and
you store
another
your ice cream
walk.
scoops at. So, so yeah.
I mean, that childhood lead prevention
Yeah.
program, lead poisoning prevention program.
Mhm.
Folks don't know that environmental health plays a role in that as well. We do in-home assessments to identify risk for lead contamination throughout homes when we received a blood lead level sample from a child that's above the threshold of what the CDC puts out.
Yeah.
So, I mean, there's so much, Jeff. Like you said, 60 seconds won't do it.
Yeah.
We could be here all day talking about environmental health, and that's how I developed my love for environmental health
Yeah. Well,
because of that.
that's the uniqueness of it, right? So it's every day is a different day. You have an infinite amount of responsibilities, yet a finite amount of resources. However, you're involved in something that's always new. I know we get so used to like reaction, what's next, of course, but you get the closest alligator canoe that's going to affect you, so you're attacking those things. But at least like you mentioned before, I enjoy being on the field, connecting with people. Those are the tenets in our profession that we get to do on a day to day basis, and that's what
Yeah,
kind of keeps us in your passion. You're continuing the march forward. You're rising in the ranks in your leadership roles. You're active in your organizations. Those are the things that you get there, and you can get there pretty quickly too. And if
yes,
you have that tenacity, or at least a drive to get out and you know, be uncomfortable and learn and be curious, get out into the field. I always say that, hey, in this profession, we're like the CSI of public health. We're the ones doing the cradle to grave, the fate and transport, the interviewing people. The like, "Nah, I think you're lying to me. Let me look around here. Oh, that's clean. Let me wrap that all up with aluminum foil so that way it's always clean. Not, oh, okay, you're actually making it worse. Those kind of
yeah.
things. You know.
No, no,
So
no. Yeah, hey, look, Jeff. Speaking of that, I remember walking in facilities before. Obviously, won't say names, but
yeah.
I remember walking into facilities before, and they have these big racks of food, right, that they've just cooked. So they see the health department. What do you think the first thing they do with that rack?
Oh yeah, start
That
covering it
hot
up.
rack. Cover it up, put it in the refrigerator. No, don't do that.
Yeah, yeah. Let's
You'd have
post
been
heat it.
better off leaving it out, right? It's
Yeah,
not a
yeah, right.
violation, yeah, if it's too
Time
hot.
temperature
It's
control. Yeah, yeah, yeah.
right. So just let it cool down. So things like that are things that things that I look out for when I'm out in the public and seeing, we kind of take the time to identify here anyway. We talk
Yes.
all the time about how we can identify where training needs are being identified. So little small things like that give us the opportunity to be out into the community and really educate and do some of the community outreach that we really should be doing alongside the regulatory piece. Educating folks should be our main priority.
Yeah, absolutely. I think we're because we're always communicating, we're in the field and having the know your stuff to be able to be convincing. So just like this medium here, we're all influencers. So we're not having to do TikTok dances or anything like that, but we're all influencers in that space to be able to change behavior, follow a regulation, so that way you're not fined for all these other pieces to that. But in certain parts of the state, you're also a commissioned police officer. I'm not sure that's the same way in Alexandria. Your experience is also in Norfolk as well. But just having a badge doesn't mean you should be using it to tell somebody to do the right thing. So you still need the influencing powers to be able to convince people in the long run. So
You
that
do.
that ties into my next question, where it segues into what areas of environmental health do you think are growing or becoming more important for that future, as maybe the people skills or the coaching that goes involved in that development process maybe not as apparent or what do you call that, deliberate.
I hate to sound like a broken record, but I think community engagement is growing. I think, previously we were called sanitarians, right?
Yeah,
That
yeah,
was a very specific job. This is what you do. You go in a restaurant and you do. But I think now with the developments in social media, with so many different platforms to share information,
yeah,
the greatest growth has to be the communication piece
yeah.
and having these opportunities presented to us to be able to do the community work. Now we have some challenges sometimes in our profession that we can work on, but that's what we're here for, right?
Yeah,
And they may create some barriers to conducting as much of that community work as community engagement work that we want to do, but it doesn't change the fact that it is a growing part of environmental health. And that's one thing we can do to make sure folks are in line and compliant. And, even outside of a restaurant, this transcends over into food safety in your home. Plenty of people have swimming pools installed on their private property, where they can learn things too within those opportunities of engagement when we go out and we are able to educate, and not just educate but learn from the community too. Technology is huge, Jeff. Things are changing every day, not just in restaurants but with swimming pools. I gave the example earlier, the geothermal wells, for heating and cooling of homes. We have to, as environmental health professionals, ensure that we're keeping up.
that's right.
So while we're out here teaching, we cannot forget to learn,
Yeah,
because I see something new every day and I'm like, we have to be humble enough, right? And
yeah,
accepting and open enough to understand that we need to listen to and say, oh, this is something new. How do
yeah,
we approach this?
yeah. Technology, biotechnology convergence, that's another like tenet within this or skill set within this profession. You always have to be open to with a growth mindset. You have to continually learn. So remaining curious to like, what is that all about? What is geothermal wells? How is that like effective in cooling your house and all these other? How is that a closed loop system? You need to know about the well drilling and where's the wells in your areas that you have to be able. What's the EPA regulation? There's so many connective pieces
Yes.
to that having the deep dive and understanding like and the curiosity but like figuring stuff out rather than like, well, that's beyond me, I'm not gonna learn anything. uh Learning to to the end of your days is what keeps the mind going. It maintains that plasticity, the neural plasticity people talk about. So you can teach an old dog new tricks, by the way. So
Oh, absolutely. Absolutely. And it keeps you going too in the field.
yeah,
Like
absolutely.
it keeps it interesting. Like we don't want to status quo our whole professional careers. We
Yeah.
don't we don't we don't want to status quo that. We want to learn. I definitely want to go out. Not that I'm close to going out, but
Yeah. Yeah.
I
Yeah. Yeah.
definitely want to. I want to, when I leave the profession, I want to be able to say I've given something to it, right?
Right.
Something meaningful to it, and I got something meaningful out of it.
Yeah. Absolutely. And that's as you are, in you're at the height of your careers and within the health department. You're manager of a very large health district. I mean, that's Alexandria. It's a population of Alexandria for all the environmental health services. It's
Mm,
much more, I
that's a
think,
good question.
much more
We're
dense
we're
than Norfolk, I think.
Well, we're densely populated.
Yeah,
That's
yeah,
the thing. Alexandria itself, I think people get us confused with Fairfax County sometimes because
yeah.
you have the Alexandria Fairfax and then you
Oh,
have the
right.
city of Alexandria.
Yeah,
While we're densely populated, we're a little bit under 16 square miles. So it's really a small area. And if you want some sort of perspective, I think Newport News, Virginia, and the Hampton Roads area, I think they're about 120 or 126 square
oh,
miles.
oh, okay. Yeah,
So we are fairly we're a fairly small and tight knit community. Now, with that,
yeah,
you'd be surprised, but with that
yeah.
um, comes some strong demands sometimes.
That's what I'm assuming. Yeah.
Yeah,
Um. So
because they're right there.
yep. Yeah.
They have, the community has no problem driving to the health department to discuss any issues, any challenges, and you have to be ready and prepared to give them what they're asking for,
Yeah.
or what they need, or what you can. Right? You can't
Right.
make everybody happy, but you have to go in with that positive mindset of doing so. And in a community like we have, Alexandria has some extremely diverse and unique communities, which I've grown to love.
Hmm.
So small, tight knit, densely populated, to answer your question. Um, Demands can be high, but they're also reasonable and understandable from an environmental health perspective.
Yeah, that's great. It's kind of, and it's shifting gears as you as a health manager. Uh, some of those questions are related to developing your environmental health specialists, your new employees. So, what leadership qualities are most important when managing environmental health specialists and inspectors?
Um, I think that's a big question too. You have to be
Yeah,
willing to mentor. You have to be willing to take the time to listen. Um, Understand that you make mistakes. Teach them everything you can. Ensure that you don't gatekeep information. Anything new that I find out, I share with my staff. When mistakes are made, be it by me or them, we understand as a team that we're working towards the same goal, and we have forward thinking instead of backwards, right? Like I don't, the best thing about mentoring is watching people grow. So when
yeah,
someone makes a mistake, be it myself, like I said, or the staff, we learn from that and we implement strategies so that moving forward we don't make those same mistakes. Um, and some of the leadership qualities again are understanding. You have to be reasonable in this field.
yeah.
You have to have
Grace.
a great deal of grace
Yeah,
and common sense. Common sense is always
yeah.
is
Not so
always
common.
good to have.
Yeah,
Listen, Jeff,
yeah,
you said it. But yeah, some of the leadership qualities I think are entailed in the things I just mentioned. I know I'm forgetting some things, but ensuring that you emphasize and re-emphasize the importance of our roles. And people will look at it. Sometimes you look at the definition of a job, or you look at your job duties, and you say, "Okay, it's like a checklist, right? I do this, I do this, I do." No, part of the leadership skills is being able to communicate with your team in such a way that they understand that it's not just a saying. They truly do have people's lives in their hands,
yeah.
and just because you don't see the illness you may have seen in previous times, right before we had
Mm,
sanitariums and before we had this long
yeah,
um, list of regulations, please know that your role is still important to make sure we continue down that path of improving and making sure we do risk assessment and risk management before we have to implement reactive care to our communities. So preventative measures matter, your role matters, and just kind of driving that point home on a continuous basis and knowing that we move together. Uh, a leadership quality that I always speak to is ensuring that as a manager, you don't forget that your boots go to the ground too. There are
That's right.
times where your boots will go to the ground with your staff, and they should. Now, managerial oversight is part of the job, the main role that you play,
Yeah.
but showing your team that you'll do anything that you ask them to do, if the situation arises and you have to.
Yeah, and that's like leading from the front, setting example. Those are like the tenets of just leadership in general. If we're working in public health, whatever discipline you're in, leadership is paramount because that employs how do you get your message across? How do you get, you're a change agent to rally the troops or rally the your compadres with you to be able to charge it in a direction. And that's important because without those leadership tenets or a servant leader or other types of leadership, it becomes ineffective to be able to run your programs or communicate to the public to effective change. You can have enforcement powers all day long, but if you can't communicate and be able to set examples and be empathetic, all those other pieces to it it's very ineffective. And so that kind of leads me to my next question, where internally, as you're developing yourself and you're developing the your EHSs and the profession. How does effective risk communication look like in environmental health? Because we're all risk managers. We're not
Right.
risk deciders. We're helping risk decision makers reduce their risks that the decision maker maybe have to deal with, and sometimes they just don't go with that. Uh, so what do you think is effective, or what does effective risk communication look like in an environmental health, to your external uh, patrons?
I think being honest, make sure that you maintain your cool, make sure that you're clear in what you say, but don't allow emotions to take over in any situation that you may have to deal with, right?
Yeah.
Um, and hey, speak facts. Let folks know what you do know, right? What we're still working on gaining more insight on. Let them know that too. Don't be afraid to say, hey, I need to go back and check on that. Or is this something that we've addressed? And you'd be surprised. I think that's how legislation is sometimes created, right,
Hmm.
Jeff?
Hmm.
We don't have the answer and we need the answer. So we do so much digging and say, hey, we need to put this into some regulatory speak
Yeah.
because we don't have a direction to answer this question. So
Absolutely.
just being clear about what you do know, what you're still working on, getting more knowledge for. And like I said, just being honest and clear in your communication when you're dealing with the public.
Yeah. So Tiffany, it sounds like you've been to a lot of town hall meetings before, having to
Absolutely.
communicate. Have you been to one recently that you had to communicate some of those issues?
Um,
That you can think an example, like, but a challenging environmental health issue that you had to handle as a team or speak to the town hall meeting? Those are not the
I'll give
those are
I can
when you're thrust into it. I know that can be very daunting, especially if you don't have all the information. Like you mentioned, like, hey, tell them what you know.
Yeah, I mean, I can give a very broad example of that comes
Yeah,
to mind, because situations were developing pretty quickly.
sure.
I won't go into extreme detail, but we did have a town hall associated with the Potomac River sewage spill.
Yeah,
That was tough um, for the community. It was tough for us, and I want maybe tough is the wrong word, right? Let me
yeah,
back that up. It was challenging for the community. It was challenging for us because, as you know, as things develop, while we have risk management and strategies in place, every situation is unique.
yeah,
So people sometimes are looking for very, very specific answers that you don't have at the moment. that you may be developing while they're asking the question. And you know that it's being worked on, and but you want to give, and it goes to what I previously said about offering up clear communication, right? We want to make sure that we have unified messaging so that we're not confusing anyone or having to backtrack and say, no, this is what we're not doing, this is what we are doing, and we're not doing what we previously said. So understanding patience, right? You remember how you said grace,
Yeah.
right?
Yeah.
We as professionals have to realize that we have to give our communities grace too when they're asking these questions. So sometimes it's challenging, but we are here, and that's what we are here to do. We're here to serve the community, answer the hard questions, whether we have answers to them or not. That's what we're here for. We have to be the face of it sometimes, and you have to know how to be that face and know that you might have a bad day.
Yeah. Yeah.
As an EA professional, you might have a day where you're off your game, and you're unable to articulate in the ways that you wish you could have. And as soon as you get out of that town hall meeting, you can think of 30 other things you could have said, or
Right.
30 other things you could have answered that question that you just didn't.
Right.
And you knock your head up against the dashboard while you're in the car,
Yeah.
um, trying to figure out why you didn't think of it in the moment.
Yeah.
But it's a process, and you
Yeah.
learn and you move on and you grow in hopes that you'll be better in year 10 than you were in 5, and better in year 15
Absolutely.
than you were in 10.
That's a growth mindset right there. So, that's these town hall meetings that we've had are challenges going through, and it's right in front of our faces that we're just having to react to, and with limited information. To me, that just reminds us of just during like COVID, that's was rapid information, not enough information actually, not enough data, and being able to do that to a nation was difficult challenge. So during some of your outbreak public health emergencies, what role does environmental health play?
So again, I'm going to speak on how special we are because I'm
Yep,
biased,
that's
right?
right.
Um, when public health emergencies arise, they a lot of folks look to administrative teams, or health directors or leadership at the higher level, right? Sometimes they look to for their skills.
Absolutely,
um, we develop a lot of skills in this profession that prepare us for being pretty significant in an emergency situation.
absolutely. Yep.
We are trained to deal with public health emergencies on a daily basis, because you might deal with a restaurant that doesn't have water. You might deal with a restaurant that doesn't have electricity. These things happen every day, whether it's
Might be a
a
fire. Yeah.
disaster,
Yeah.
exactly, whether it's
Yeah.
a natural disaster
Yeah.
or fire
Yeah.
or a pandemic, right?
Yeah.
So a lot of times we're called upon to play roles that are outside of our traditional roles, right, and outside of our job duties, but we're able to take the skills we have in environmental health, be it logistical skills, planning skills, like you
Planning's
said,
huge. Yeah.
yes,
Yeah.
our CSI capabilities,
That's right.
uh,
Yeah.
whether it's taking those things, and they do transfer over into other roles during an emergency, like COVID
Other sectors.
19.
Yeah.
Yeah, I had the honor of playing a major role in logistics during the COVID-19 response for our points of distribution, our pods,
Yep.
activities where shots were administered or vaccines were administered. Having all these different locations where you have to make sure you have this amount of equipment for this site, this amount of supplies for that
Yep.
site, and
Cold chain
vol-
management. Yeah. Yeah.
listen,
Yeah.
volunteers are, I mean, they are invaluable. You can't put a price tag on how many MRC volunteers stepped up to help during that response. But um, yeah, environmental health professionals were tapped on the shoulder to say, "Hey, can we use your skills to
Yeah.
play a major role in planning?" So I appreciate what that leads to.
Yeah, that's a great example because even from my own experiences, as later in my career, I got into more strategic planning in the health systems domain. So, because of our innate abilities that we collect in tool sets, you're able to uh, have a wide range of jobs or professions you're able to step into and be really good at it from the get go because we're just innately that's part of our development process. So, that really leads to a segue to, what are some misconceptions to the public about environmental health inspectors? So, just the word inspectors alone, I think that's all we do. It's like the Larry the Cable Guy health inspector, right? So, that's what they measure us on. So,
I think some misconceptions are that we only conduct food inspections,
yep,
restaurant inspections. Other misconceptions are that we work off checklist, or um, we're here to write as many violations as we can. We'd rather not have to do a lot of paperwork if we don't have to.
yeah,
So that's
yeah, yeah. We're killing trees too.
so right, right.
Yeah,
Though a huge misconception is that we're looking for violations. We're actually looking for opportunities to educate and opportunities to make um, operators understand the importance of public health and how to make their business run more smoothly. If we can go in and educate and get them running to because mistakes cost, right? If
yeah,
you have foodborne illnesses inside of a facility, or you have waterborne illnesses, those mistakes cost, and we are here to
yeah.
minimize the cost of mistakes. I say
Especially
that's a
mom and
simple
pop
way.
businesses that something like a hepatitis A outbreak in their mom and
Yeah,
pop business, they're out of business. It takes $1 million to start a food business to make 1 million. So you're you're
absolutely.
you're breaking even. So it's a tough business. So yeah, it's a great point or analogy that you mentioned, is that it's cost savings in the long run, which is people's livelihoods.
It
So
is.
those livelihoods and our ability to be able to interject and help businesses, help restaurants to be able to not be out of business. So, and simple adjustments. We're asking them
Right.
for the bare minimum too, right?
Yeah, exactly. And we don't we don't stand to gain, as public health officials, we don't stand to gain anything from violations, at a facility. We want folks to stay in business.
Yeah,
We actually want to build stronger relationships with local businesses and make sure that they stay there.
yeah,
It's important, because right, you're providing services, but you're also providing a necessity, right?
yeah,
Food, water, clothing, shelter.
yeah.
Um, Literally some all the things that we
Yep,
that
we're
we
involved
play a
in.
part in. Like,
Yeah, yeah,
we want you here and we want you thriving.
yeah. That's great. It's a big piece to that. It's the basic necessities of life that we have a hand in and are actively doing that on a day to day basis.
And
So,
we should remember
okay,
that too.
yeah,
We should remember that too, Jeff, as we're conducting our work throughout the day as professionals. We should remember that we do play a big role in that, and we do want to make sure that we're doing everything within our power, um, to encourage good practices to stay in business, because the priority is to make sure that we're keeping the public safe and the community safe, but we also want to make sure that we have thriving businesses in that community. That's what makes it beautiful, right?
yeah, yeah. So if you were, you know, convincing uh, or giving advice to somebody that's entering this profession or beginning school or high school or college students considering environment, what would you give them to vector them as this direction? Maybe something that they may have not had interest in.
What would I tell them to draw in the interest
Or what
into the
what
field?
advice would you give? What advice would you have liked instead of stumbling on it like many of us have? You know?
uh, be patient with yourself. I wish I would have gotten that advice, Jeff.
Yeah,
Have confidence that it will be okay.
yeah.
It may seem extremely overwhelming in the beginning, but you will get through it. And once you get through it, you will come out. You'll walk through the door a little bit overwhelmed, but you'll walk out the door with knowledge that you didn't even know existed, or that you didn't even know the importance of. And just a sidebar, on the food safety and inspection side, one thing I really wish somebody would told me in the beginning, it seems so simple, Jeff, was take the food code, read the annex.
Hmm.
I know that seems like a simple thing, but if you get into food safety inspections, read the annex. Lean
Absolutely.
on the annex. And it will give you your public health rationale. It will allow you to understand so much more about the regulatory work you'll be doing as it pertains to food safety.
Yeah,
But no, that's the biggest thing, and
that's
it's
great.
fun.
Yeah.
I wish somebody would have told me it was fun. As time went along, I learned that there were so many interesting things that you could be a part of that you didn't even know existed, Jeff. I'm still learning things that exist up under the public health or environmental health realm, and the opportunities for you to be a part of those are there. Um, yeah, so that's pretty much what I have for that.
What qualities would stand out for if you're hiring or mentoring new professionals for that would be beneficial in environmental health?
Communication skills, um, that empathy piece you spoke to earlier, understanding how to communicate, understanding that your role is to be an educator first. Time management skills are essential.
Yeah.
Um,
Why is that?
understanding your, huh?
Why is time management so essential?
Because like I was speaking to before, I love this field because you're not stuck in an office
Yeah.
every day, right? So you have that opportunity to create your own schedule throughout the day, right? You might have the work is there, right?
Yeah.
It's the work that's entailed in being in environmental health, but you have the freedom to work around your own schedule, as it pertains to, like I said, the work. The schedule is
Yeah.
schedule, the start time, end time,
Right.
but you're able to be creative in what you're going to do for the day. Like,
Yeah.
am I going to inspect the restaurant today, or am I going to inspect the pool? Making sure that you're keeping up with those, right?
Yeah.
And making sure that the work is getting done while you enjoy the freedom of being able to kind of work around your schedule throughout the day.
Yeah. That's sometimes you can actually burn yourself out because you
Yes.
forget, right? So and I think when during COVID, I don't know if it was the same, when we all mostly went to remote, we're still doing the work. Now we're just, starting our days at our home rather than starting it in the office first. I remember when I worked for VDH as a food security specialist, I was working out of my house all the time, state car, all that
Yep.
stuff like that. And I found myself working more being at home than I do like working in an office because it just becomes part of your daily life activities. It's like, wait a minute,
Yes.
I got to turn this off now. I got families and other things like that, right?
It
So
yep. Time management,
yeah,
that work life balance.
yeah,
But time management and documentate, this is something I should have mentioned soon. Documentation skills. Being able to make an observation, record that observation, and understand that the observation may come back and resurface in a legal setting.
yeah, yeah.
It's
Everything you write is
important.
is a legal note.
Correct.
Right.
It's important to make sure that you write with accuracy. And sometimes we overthink, right, Jeff? Sometimes we might document too much, and you're like, then it doesn't read as it's intended to read and as it's supposed to read for
True. Yeah.
accuracy.
Yeah.
So, but under documenting, it has the same impact. So, understanding there's an art to documenting in the environmental health field. There really is. And making sure that you consistently do it because um, it matters.
Yeah. Oh, absolutely. That's it's part of the administrative. I call it administrivia, but it is part of your administration of that of your writing. Whether you're putting it into a database on a computer system, you have to be really good at your admin because that is your defense in any type of legal setting. Your evidence that you're whether you're presenting a case, all that stuff. I would say, hey, you're doing so many legal things in this field that those translate into other professions. Maybe you want to go to law school after this or
Yes.
something else. So because we're so practiced in those details, you know, and that as this goes to the kind of the culmination of this interview. Can you tell me what has been the most rewarding part of your career?
The most rewarding part.
Yeah.
I have a lot of rewarding moments in my career, but the most rewarding part is when folks are able to, residents and people we interact with, clients, are able to walk away knowing more than they did when they started the conversation with us. Um, Being able to get out into the community when children are involved. Obviously, a lot of folks, such as myself, have a soft spot for kids. So
Yeah.
being able to do, swimming pool education in the summer, and educate our residents on rabies prevention. I, I can say the highlight of my career was being able to be a part of that EMAC mission in St. Croix and kind of travel out to help that community recover from Hurricane Maria, and play a part in that, and exchanging ideas and exchanging information, understanding how their health departments work on the island, and as opposed to how we work here stateside.
Yeah.
Um, Still the United States, but you know what I mean.
Yeah.
Landside. So, that was a highlight to my career. The whole trip was rewarding. And then COVID-19, I hate to be cliche. I'm pretty sure people have said that before, but it really was a rewarding time.
Yeah. It's not
You
far
get
too
to
far
step
removed.
outside.
Yeah. I mean, talking 6 years
Right,
ago.
right.
So
I can't believe that we can actually tell people that we were here during
yeah.
that time.
Yeah.
uh, but no, that was rewarding because not only did you get to work with the community, you got to work with MRC volunteers, you got to work with people from other divisions. And we
Yeah.
do here, we're lucky at our locality. We do a lot of cross divisional work, but it allowed you to get to know your colleagues and your coworkers better. That was a time where we had to stick together and get the work done.
Yeah, yeah. That's you're grinding it out, and it's when the world or the nation not understands or knows what you do. That's really the first time my own family knew what I did for a living. It's like, oh, you do that? Oh, the contagion stuff, like in the movie. Yeah, we're doing it. We're on the ground, so we're the emergency infectious disease response of that during the COVID, especially when I was for the Navy and COVID-19 hit our carrier in Guam. So, and back in February, it's a different story. So maybe someone can read me on that one. That was a challenging and difficult time, and the information was coming at us as a freight train, and we were still trying to analyze it. So that
Yes.
goes back to how do you stay passionate? What keeps you motivated in public health?
Mm.
It's tough because there are days when you're just like getting kicked in the face, but it's that
Watching the
returning that. Yeah.
I you know, I stay motivated because again, it's such a dynamic field. I stay so motivated because I mean, at least while we have our days, right, where the job is challenging due to the nature of the work in itself, a lot of times we have great positive outcomes. The community is grateful for what we do. When we have a complaint and we go out and deal with that complaint, and I just stay motivated in the fact that we watch foodborne illness numbers go down. I'm able to look at data. Shout out to all the epidemiology teams,
Yeah.
and all the informatics people who play a role in making sure that we can track that data, because that keeps me personally motivated, as a professional, knowing that our work makes a difference. Whether it's said on a bullhorn or is whispered in somebody's ear does not matter to me. Don't care if we don't get the credit. Just knowing that we're doing the work and we're seeing the outcome of doing the work, that keeps me motivated. And being able to do stuff like this, Jeff,
Yeah.
and meet people like you, and I'm able to have an ear, right?
Yeah, absolutely.
have
Sharing our
have an ear
misery.
for the
No,
have
not
an
at
ear for
all.
the good days
Yeah,
and the
yeah,
bad days.
yeah,
So yeah, that
yeah.
keeps me motivated.
And that's ultimately the purpose of this whole series is to bring out the behind the scenes work and the silent service that we are to the public because not we're not really good at messaging about what we do because we're so niche. And this conversation, and I really grateful for you having this conversation with me, is to really present to the public and people that are willing to spend the 45 minutes to watch this, that they may get something out of it. Like I did not understand what they did. What's the process, or what? I didn't know I could take my skill sets or my education and go down this path, and be a rewarding path that's fulfilling. The same dopamine response you get from saving a life. If you're an EMT before or did any of that work, that same kind of that rush of you're locked in and saving somebody's life, you get the same sort of dopamine response when you do a change in behavior into a family or a population. That's that's what drives you. That lights my fire, at least, and I think that's a lot similar to everyone else in this profession going forward. That's
Right.
so. At the end of all this, for anyone watching, what message would you like the listeners to take away about environmental health, and the people working in this profession every day?
We're here. We're here to serve. We're here to stay motivated, like you just spoke to, Jeff. We're here to understand, listen, give a lending ear. Um, Make sure that we put regulatory compliance in the mix with, not ahead of, in the mix with education to our communities. Ensure that we stay moving the profession forward. Not just saying everything's good from 2017 to 2026, but understanding and identifying what our community needs are. Because while we have other divisions and departments that work on that daily, we also have a personal responsibility as public health professionals to identify and assess needs in our communities as they pertain to environmental health. Stay the course. It will get better
Yeah.
if it's not going so great. And if it's going great, you may have bad days, but
Yeah.
again, it
Expect it's
will
gonna
be
come. The storm
better.
will happen. Yeah. Yeah.
Yeah, the storm will have, but that's with any profession, right?
Right.
And
Right.
just enjoy yourself. Don't
Yeah.
take your just because you're a regulatory body or department, don't take yourself too seriously.
Yeah.
Laugh when you're in a
Yeah.
restaurant conducting an inspection.
Yeah.
Laugh,
You're building
smile. You
relationships.
can
Yeah.
still be light. Yeah, you can still
Yeah.
be lighthearted. Build relationships. Obviously, put the work first, right? Put the work first and the mission first of keeping the communities healthy, but enjoy it. Enjoy yourself because you'll look back like me. I heard you throw those 15 years in there. That was rough for me to hear. Um,
That's not long enough. No, you're
uh,
good. You're good. Flies by, right?
but yeah, time flies when you're having fun.
Yeah.
But when you look back, you're gonna wish that you took more opportunities to have the fun and enjoy being lighthearted and being able to mix that into doing the work. If you don't do it now, so just enjoy it, learn from it, and know that being an professional, you could very well end up on Jeopardy one day and be successful because you will know a lot of random things.
That's right.
Uh,
That's right. I tell my students all the time, I said, you know what? You're going to leave out of here and be like, kill it in trivia night at the local brewery. That's going to be a
right.
skill set that you're like, how do you know all this stuff? That's why my wife rolls her eyes every time. So you know it all. So I'm like, I just
Yeah.
happen to run across this information. Yeah.
Yeah, my husband does the same. He used to go out to lunch. He's like, "Hey, I'm about to go to such and such," and then he's like, "Be quiet, don't say
Yeah.
anything, just let me go to lunch." I'm like, "Listen,
Yeah.
I'm off.
Intestinal
Enjoy
fortitude.
your lunch."
Yeah. Iron stomach.
Look,
That's matter.
if it's open, it should be safe,
That's right. That's
and
right.
that's what we lead with, right? Like, I hate to go into that, but before we wrap up or go on to the next question,
Yeah.
I do want to say that when you're doing these inspections or you're inside a facility or you have some sort of direct involvement, make sure that the work you do brings a facility to a place where you too will patronize it.
Yeah. That's
So
a
you
great
should
point.
never walk up out of a restaurant or walk off a pool facility and say, "I would never let my kid eat there," or "I'll never let my kid swim there." Then that means that you, as an individual and as a professional, have some work to do in combination and in collaboration with that facility. But do all you can to make sure that you are providing a service to facilities that you would patronize.
That's a great, great point. So I'm going to ask just two more questions from you. that would be good for the audience. So, what is your most unusual inspection that you have done?
The most unusual inspection. I'll tell you this, and it wasn't really unusual due to much related to environmental health. But
Yeah,
the most unusual inspection I've conducted was walking into a restaurant to inspect it, and as soon as I walked in the building, there were no windows.
really. Oh, so that's
Yeah,
a
like
skiff
nobody could
secret
see from
facility.
the
Yeah, yeah.
like that was the most unusual inspection, and I always felt a bit uncomfortable about that one.
You have to have a
But yeah,
security clearance before you go there.
look,
Yeah,
it's like you disappeared into a black hole. I don't know what
yeah,
that was about, but
yeah.
it didn't have any front windows, so nobody could see you from
Nondescript
a parking
building.
lot.
Yeah, yeah, yeah. All
And I
right.
mean, I watched a lot of crime TV too. I could have just been paranoid, but
So wait a minute, there's a bunch of guards you had to go through, and it's badges, and they had to scan everything on me. Yeah, yeah. So,
yeah, they had not.
yeah, go ahead. Go ahead. Sorry.
Yeah, it was just the setup of the facility.
Mm.
It was one of the strangest things. Once you walk in, it, you feel some type of way. I'm like, is this in code? Like, are we supposed to be doing this? Why don't we have windows in front?
Yeah,
And I think they had like some random window in the back, but there was nothing in the front. Once you went in, you just kind of sunk into the black hole.
yeah. I needed 100-foot
Um,
candle lighting, right? So,
listen, and then one unusual inspection where um, we had to climb up to the attic where a refrigerator was located. Those are the two probably most unusual per se. Yeah.
oh, that's great. So, one environmental health myth to bust. If you can't come up with one, that's fine. That's a difficult one.
One myth the bust. I think I already did that earlier.
Yeah,
Um, and you helped me do it. One is we don't only inspect restaurant facilities. Another myth is that we want to write violations.
yeah, that's a good one. No, that's a good one.
Uh,
Yeah,
and for the love of everything, a huge myth is that when we call you about an animal bite, that we want to take your animal. We do not.
right. Yeah,
We do not have the space.
right,
Um,
right.
we do not have the cars. I used to always think it was hilarious when we said at one district we drove our personal cars, and they're like, "Are you gonna take my dog?" I'm like, "Not in this 4 door,
Yeah, right. Yeah,
small sedan." So just that myth is a big one because rabies
yeah.
prevention
Oh, yeah.
is
That.
such an important part of what we do,
Yeah,
Jeff. That is one time where the job is rewarding too, where people don't know
yeah,
that rabies is 100% fatal.
yeah,
And you did call that person and tell them to get shots or handle this wild animal this way,
yeah,
and they didn't know that this is something that could be the end
yeah,
if I don't handle it appropriately. So
yeah.
those are the myths. We're not here to take the animals. We're actually huge animal lovers, believe it or not.
Wow, that's great. Well, Tiffany, I thank you for having this conversation with me, and it's been great. It's like reliving your past life and being able to commiserate with you, but at the same time, this going back to what you're saying is educating the public and awareness, and maybe somebody could be our replacements, right? So and come to ODU for your as an alumnus here and a program that we're supporting that. So again, thank you so much. I'm very grateful for you being my first guest in this podcast series. So taking the time to go through all the troubleshooting and working that out, and helping me learn better as well. So again, thank you. I look forward to seeing you at the VHAC conference next
Yes.
Friday. I'll make sure I get
Yes.
my slides out to you guys soon. And I think it has a little bit of the same theme that I'll be talking about ways to
Yes.
be able to improve our profession and be able to advocate and champion it. So that way we have we're force generating for our replacements in the future. and when the
Absolutely.
jobs are plentiful. Are you hiring right now for any openings?
Yes.
Yeah,
Um,
yeah. So
Virginia Department of Health.
yeah,
Yeah,
listen up, guys. If you're looking for a job in Alexandria, if you want to, if you're from there, move back home, what have you, or move to Northern Virginia, you got Tiffany, Johnson-Wiggins here to be able to look for you. And she already told you what the skill sets you're going to need to apply. So
Please, please. On a serious note, Jeff, thank you for having me. I always enjoy speaking with you. It was my pleasure and an honor to be able to sit down and talk to you
it's
with
great.
you having such you're a pillar of knowledge yourself, and I just love hearing you talk. So
Thanks.
this would have been just as fun had I been able to interview you.
Yeah, yeah,
So
yeah,
thank you.
yeah,
So thank you for allowing me that. And we are looking for new professionals in the field, not just in Alexandria, but just in general. It warms my heart to see when people actually enter this profession, enjoy it, and build a career off of it. So good luck to anybody out there listening, and hopefully you'll join us in this great heavyweight march uh,
yeah.
to environmental health. Thanks, Jeff.
All right, Tiffany, take care of yourself. I'm looking forward to seeing you soon. Thanks,
You
everybody.
too. Take care.
I want to thank Tiffany again for that wonderful discussion, questions and answers that she took from us, and being able to describe her day and her challenges and experiences, and at the same time share some of our past experience, my past experiences in the field, and be able to go through those those times reminiscing. So I really appreciate Tiffany. She's an environmental health manager in Alexandria. She is a busy woman there, and she's running a quality shop. And if you're looking for a job, she's got one open. So make sure you're looking for opportunities up there in Northern Virginia. Thanks again. Stay tuned for the next podcast. Bye bye.